So thank you all for being here today. It's really exciting to hear from so many different projects and so many different folks working in this space. My name is Annie Taylor. I'm the Evaluation and Data Manager in the Department of Early Childhood in Boston Public Schools, and I'm here today with my colleague, Paola. Paola, do you want to introduce yourself?
Sure, thank you, Annie. I'm Paola Guerrero. I'm a doctoral student in the combined program in education and psychology at the University of Michigan, and I work with the UPK project as a doctoral student.
Thanks. As Paola mentioned, we're two members of the Universal Pre-K study team, and we're here to share some of our initial descriptive findings from our recently released brief titled Effects of COVID-19 on Early Childhood Centers. So this will be a summary, but Paola will drop the link to the full brief in the chat momentarily. We did want to acknowledge the partners in this work, including our fellow authors, Chris Weiland, Louisa Penfold, Catherine Snow, Jason Sachs, and Megan McCormick. And a few additional folks might be on this call. I know Louisa should be here soon if she's not here already. And we, of course, wanted to thank the UPK centers who are participating in the study. So today we'll provide an overview, just a quick background information on the UPK program and the UPK study. And then we'll discuss some of the adaptations we as a study team had to make, the purpose of this report, and then the data used, and we'll get into what we found and some future directions. So just to ground us in what we're talking about, the Boston UPK program is a citywide initiative that's focused on providing high quality pre-K to 4-year-olds in Boston. So it's a combination of both 4-year-old seats in public schools and community-based organizations. And historically, community-based organizations, or CBOs, have served additional student populations, including a significant percentage of students of color and dual language learners. The expansion of UPK into CBOs was created to provide that additional access to families and to meet families where they are and ensure that more have access to that high quality education that we know is so critical in these early years. A critical part of the UPK program is that quality element that I mentioned, and these are some of the inputs or activities that the UPK program provides participating CBOs to really ensure that the program is of high quality and that folks have access. So we wanted to kind of ground this brief and this work in the realities of doing research during the COVID-19 pandemic. The UPK study team was originally tasked with understanding the barriers and facilitators to implementing and expanding high quality pre-K in community-based settings. And when the pandemic hit, it was very obvious that we needed to adapt and shift to really support the centers. So we shifted our focus this year to really documenting the impact on centers and the changes that were required of staff, teachers, and families due to the pandemic. So in our original plans, we had things like in-person observations and interviews, direct child assessments, and we shifted all of that to some remote interviews, exploring the remote coaching model, doing online surveys and things like that to really, as I mentioned, understand the impact that this crisis is having on our sector. And we are extremely grateful to both UPK admin and community-based staff for being flexible and supporting us and helping us with all of this remote data collection.
And sorry, just adding in those acknowledgements to the coaching team, because they really adapt quickly to how to respond and support centers during the pandemic.
Definitely. For this report, we focus on the question, how have participating UPK community-based organizations been impacted by the pandemic in the areas of staff turnover, child enrollment, and operational changes? We used administrative data, including enrollment and staff lists. We used reopening plans that centers submitted to EEC, and we used CBO director interviews. The study sample included 17 community-based organizations that have a total of about 35 participating UPK classrooms. So what did we find? First, we looked at staff turnover, and we found that the turnover rate for teachers compared to pre-pandemic levels was about 18%, and for admin, it was 10%. So it is hard to compare this pre-pandemic turnover, or this turnover level, to pre-pandemic turnover because we don't have the same robust measure. But these turnover rates of 18% and 10% are still a little bit lower than what some other communities have reported, even pre-pandemic. But what we do know is that turnover can create challenges for quality improvement, especially when so many of the quality supports provided by the UPK program, such as curriculum, coaching, and professional development, are provided directly to staff. So oftentimes one-on-one or in small groups. And in this graph is specifically looking at teacher turnover rates and percent of centers reporting that range of teacher turnover rates. We also found, looking at child enrollment, we found a dip in enrollment when comparing to pre-pandemic levels. So the first year of UPK, which was the 2019-2020 school year, enrollment hovered around 86% at its highest. However, in the fall of 2020, only about 56% of UPK funded seats were filled. So that's a drop of about 30 percentage points. Due to the hard work of both UPK admin and CBO staff, enrollment did increase to about 70% by the winter of this year. So about January 2021, the seats were about 70% filled. But this does have implications, especially as we're thinking about enrollment for next school year and really understanding what our families' preference is right now, what are their pandemic-related concerns, how can we make sure that folks who want a seat and can get their concerns addressed, that they're aware of the seats and can enroll in a safe and high quality setting. The next part of the report, we used community-based organizations' reopening plans to explore what operational adaptations sites had to make in order to safely reopen. So here in this graph, you'll see the percent of CBOs reporting changes to safety and cleaning practices. So this obviously was a critical part of this need to safely reopen and was a huge adjustment that a lot of centers had to make. These red bars are changes that required an additional direct cost. So things like hiring additional staff and areas for isolation. Some centers, about 40% of centers, reported that they would need to hire an external cleaning contract to meet the additional cleaning needs. And then other items such as using masks or additional hand washing guidelines, most centers reported changes in that, but it didn't necessarily require an additional direct cost. A big one here is maintaining the stock of PPE supplies and additional cleaning routines. On this next slide, we see the changes to instruction and child routines. So the most frequent changes noted here were the addition of individual learning materials, obviously coming at an additional cost. And we've all seen, I think, either seen it in person or seen it in pictures, the individual child containers of their materials, as opposed to sharing materials as we've previously done in classrooms. Some CBOs also reported necessary changes to curriculum components such as centers. So for example, removing some center options or only having one center choice per day. So this really highlights the impact that the changes that were needed to keep children safe had a pretty significant impact on the student experience in the classroom and how the curriculum, which is part of that quality element of UPK, is implemented. And here you'll see two students sitting with their little taped sides of their desk having a read aloud. The next part that we looked at was changes to staff schedules. CBOs reported significant changes to staff schedules, including the need for additional staff. So the majority of centers, or about 74% of them, reported they would hire additional staff to meet requirements, and a similar percentage also reported they would need to budget for backup staff to cover medical leaves. Additional changes were more trainings or more weekly staff meetings to make sure that folks were all on the same page about the needs of the center. And a lot of these, as you can see, came with additional direct costs. One thing I would add on this piece is that a lot of these changes we're talking about in terms of the staffing, not in a lot of cases, folks weren't, nothing came off of a teacher or a director's plate. It was more that things were added onto it. So it was additional things that folks were required to do. And then this last piece in terms of operational adaptations is looking at changes to family communication. So this was pretty prevalent in the reopening plans. Changes included sharing preventive health information, communicating about assigned and specific drop-off and pickup times, and updating contact information more frequently to help with any contact tracing that might need to happen. And about 57% of centers also indicated the need to secure additional interpretation and translation services to make sure that that connection and that communication with families was as transparent as possible. And that oftentimes comes with an additional cost. An important part of the study is hearing directly from center staff about their experiences. So Louisa Penfold from Harvard leads our qualitative work. And this is one quote that highlights both the good and the bad. And I will go ahead and read it. It's from one of our program directors. They said, "I think one of the reasons that we are not as hurt as we could have been was because the Department of Early Education and Care. Commissioner Sam really understood what the centers that have contracts are facing. We lost a lot of our private fee-paying parents, and with that, you lose income. Since most of our families are on a contracted slot, the department's commitment to paying us for children, even if they were not physically coming, but maintaining their enrollment, has made a major difference. So that has allowed us to be a lot more stable, plus our fundraising and development department has been wonderful. So we have had funds come in from Boston and other people that have helped us through the hump. I know that we're lucky. We're in a different situation than most in the field." And this really highlights that there were all those additional direct costs that we mentioned. There is a need for funding to fund all of those. We also heard about the resilience of children, even in the face of all of these changes that we have mentioned. One education supervisor said, "We are trying to incorporate the social distancing and mask wearing into the new normal. What's amazing is how resilient and how accepting kids are." So as we think about these findings and how they highlight some of the many ways that CBOs have been impacted, the results do suggest the need for additional staff retention support, enhanced enrollment and marketing efforts unique to the needs of families, and continued financial support of the early childhood sector through the pandemic and into recovery. The UPK study team will also continue exploring the impact and the needs of centers, teachers, and families more directly. So we'll continue the virtual coaching logs and surveys. And then in the future, when it's safe to do so, we hope to be able to do some in-person observations and be able to understand that quality element within the classroom. And that is the end of our conversation today, but we're excited for folks to read the whole report and to continue to have this discussion and think about how we can best support the field moving forward.